This video is to demonstrate the fluoride varnish process evaluation. Identifies patient need for fluoride varnish based on risk factors including high caries rate, orthodontics, recession, hypersensitivity, numerous restorations, gag reflex, xerostomia, demineralization, poor OH, heavy biofilm, radiation therapy, drug abuse, physical or mental disability, children under 6, etc. Explains rationale for fluoride varnish to patient, including benefits, and ensures patient acceptance with post-op instructions.
Alright, Jess, we're going to go ahead and apply the fluoride varnish. It's got a higher potency and it retains longer on your teeth. And we just go ahead and paint it on your teeth, and we'll just have you not brush or floss for 4 to 6 hours, and it will just absorb into your teeth for the next 24 hours.
Verbalizes the treatment sequence of fluoride varnish, which is following complete scaling, polishing, flossing, dental exam, and instructor check. Explains the application procedure to the patient and instructs the patient not to swallow during the procedure.
So Jess, I'm going to go ahead and lay you back. We'll dry your teeth off, and then I'll take the fluoride and just paint it on each surface. I'll have you keep your mouth open as I do and not swallow. Afterwards, you may have a little sticky film that looks a little fuzzy. Some make your teeth look yellow, but ours here doesn't, but they may look a little fuzzy for a little bit.
So instructs the patient that the teeth will have a yellow film. It might or might not, depending on the kind of varnish you're using. Demonstrates all criteria for infection control for obtaining supplies and during the procedure. So she already has her varnish on her tray right here, and she has all of her PPE on. Positions the patient in a supine position. And then she will peel back the foil from the individual unit dose package and dip applicator brush in varnish and mix the varnish well. Good. And then she will instruct the patient to swallow to remove excess saliva from the mouth.
Go ahead and swallow for me.
And then she will dry the mandibular teeth with gauze and or air. She will apply a thin veneer of fluoride varnish to the mandibular buccal, occlusal, and lingual surfaces of all teeth, making sure to include interproximal areas and cervical thirds. So during this time, she is paying a special attention to all areas of the teeth, including recession, cervical third of facial and lingual, occlusal surfaces, interproximal surfaces, areas of hypersensitivity. Once she's done with the whole mandible, she will instruct the patient to close to allow saliva to contact the varnish and set it. Then she will repeat by drying the maxillary teeth with gauze and or air, and then we'll apply a thin veneer of fluoride varnish to the maxillary, buccal, occlusal, and lingual surfaces of all teeth, making sure to include interproximal areas and cervical thirds while keeping the teeth dry. She will avoid getting excess varnish on lips, clothing, etc. Instructs patient to eat soft foods, drink through a straw, avoid hot drinks and alcohol, and not to brush or floss for 4 to 6 hours. And she then will inform the patient that the varnish will be removed the next day during brushing and flossing. And then we will record fluoride varnish on the treatment record, including brand name, complications, and documentation of post-operative directions given, as well as the treatment code.